In today's COVID-19 update, the Minister of Health, Dr. Frank Anthony, is appealing to citizens to be patient and not to worry as the government works to get more Sputnik V second dose vaccines. The government is also working with its partners to acquire vaccines for children. Minister Anthony, thank you so much for joining us. I want to begin by asking you just to give us an update on the AstraZeneca vaccines that we're receiving from the UK.
Well, we have signed an agreement with the UK to receive about 84,000 doses of AstraZeneca vaccine. We have been having negotiations with the UK for a couple of weeks now, and I'm extremely happy that these negotiations have resulted in us getting these doses of vaccines. This would complement the vaccines that we have in Guyana, and as you know, we've had good experience using AstraZeneca vaccines here. It was the first vaccine that we received, and we have good experience working with it. What it also would help us to do is to get a lot of this vaccine out to communities that have challenges with cold storage, because these vaccines can be stored between 2 to 8 degrees Celsius. So it would work well, especially in the interior communities.
And I know persons are thinking that the vaccines that came from India initially are different to that set that is coming now. Could you just guide me through that?
AstraZeneca vaccine is being manufactured in a number of countries. It's the same vaccine, however, because of the place where it's manufactured, there can be that difference. Difference in the sense that it is manufactured in India, it's manufactured in Europe, manufactured in the UK, so it's just the manufacturing site. There has been, about a month ago, an issue that erupted in Europe, and that is the European Medical Regulatory Body was not accepting persons who were vaccinated with AstraZeneca made in India. That's the COVID shield. And that created a problem, but I think they have been working to resolve it. Because the AstraZeneca made in any one of these factories in any part of the world is the same AstraZeneca vaccine. They have to follow the same standards, meet the same requirements, and they have been certified that they met those standards.
I wanted to ask you also to provide an update on the vaccines that are still available, first and second doses right now in the country.
We have 3 vaccines that we are using, AstraZeneca, and with the addition of this 84,000 doses that we are receiving from the UK, we have more than enough AstraZeneca vaccine for anyone who would like to get an AstraZeneca vaccine. We also have a Sinopharm vaccine. We bought 100,000 doses. We have that in the system. Again, this vaccine, the storage is at between 2 to 8 degrees Celsius, so we can use that in remote communities where we have challenges with ultra cold storage. And we also have the Sputnik V vaccine. We have a lot of the first dose that is available. As you know, we have been getting second dose in increments, and this week we received 10,000 second dose. We have allocated these second dose to people who got their first dose in April and in May. Right now, I think we have been able to distribute it in all the regions so that people can get their second dose. And we're right now at the tail end of that shipment that we received. So I'm asking people for their patience as we work to make sure that we get more doses in. there is going to be a second dose for everyone who took the first dose. So I don't want people to be worried about that. And we have been constantly working to make sure that we can get supplies in. So as we get those supplies in, we are going to announce it so that people can come and get their second dose.
I know you mentioned that the Johnson & Johnson will be here by August. Can you walk us through just basically the administration and the storage protocol of that vaccine?
We are getting these Johnson & Johnson vaccine through an arrangement that CARICOM broker with the African Union. We have already paid for these vaccines, and we are now awaiting from the African Union the date of arrival of these vaccines to Guyana. Once the dates are confirmed, basically they will ship it in cold containers, the appropriate temperature. In those containers, they would have a tracker that accompanies the boxes. And that tracker is able to tell you the temperature of the vaccines throughout the journey. We are able to see that log of the temperature. And by that, we'll know whether or not the cold chain was maintained. If there's a breach of the cold chain, then there can be problems with the vaccine. So far, with all the vaccines that we have been receiving, we haven't seen any breach in the cold chain because we monitor these things very closely.
Will the government be procuring vaccines for children anytime?
We have been working with a number of partners to get vaccines that would be appropriate for children. Of the vaccines that have gone through clinical trials, there are only 2 right now that has been given emergency use authorization for children, and that is Pfizer and Moderna. And they have recently received approval for children 12 to 18 years. And so in some countries it is being used for this population. So we are in negotiations to see whether or not we'll get those vaccines. And when we get those vaccines, we want to offer it to the children population. As of yesterday, we've had 249,908 persons who received their first dose vaccine. And for second dose, we've had 136,919. No. The simple reason, if we had such a simple test, then all this work that we are doing with antigen and PCR would be totally unnecessary. But one of the signs of COVID is some people would have respiratory distress. But as you know, there are lots of people who would be infected with the virus that can be asymptomatic, meaning they have no symptoms, so they don't have any breathing problems. And therefore, if you use this test, then persons who are positive would not show up in the test because they're asymptomatic. So it's a myth.
Well, that's it for today's COVID-19 update. Of course, we just spoke to the Honourable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and of course, our social media platforms.